Hello everybody, I'm Prabjot Kaur and I'm going to represent this presentation on behalf of my whole group. Our topic is on diabetes mellitus type 1, that is case study 2. I'm going to start with the introduction of diabetes. Diabetes refers to a group of diseases that affect how the body utilizes glucose. Glucose is an important source of energy for the cells that make up the muscles and tissues. The main cause of diabetes varies by type. Chronic diabetes conditions include type 1 diabetes and type 2 diabetes. Now the classification of diabetes. First of all, type 1 diabetes. Its definition is pancreatic beta cell destruction usually leads to absolute insulin deficiency. Then type 2 diabetes may range from predominantly insulin resistance, insulin deficiency to the predominantly secretory defect with insulin resistance. Gestational diabetes, glucose intolerance with onset or first recognition in pregnancy. It is caused by placenta during pregnancy. This is the case study and we are going to answer some of the questions throughout the presentation that is based on this case study. Starting with the physiology of type 1 diabetes. Type 1 diabetes, also known as juvenile diabetes, is not very common as it is observed in young people. Physiologically, the person's pancreas does not produce insulin at all, or it produces insulin in a little amount, which is not enough to control the amount of sugar or glucose induced by an individual on regular basis. It is an autoimmune reaction where the beta cells that produce insulin are destroyed by one's body. Next is effect of type 1 diabetes on growth. After research regarding patients with type 2 diabetes, it is observed that insulin affects the growth of hormones. In turn, it causes hypersecretion of growth hormones, result in abnormal growth patterns in teens with type 2 diabetes. It is referred as Muriac syndrome. Even there is a huge risk of kidney and nerve damage in future. Patients with type 1 diabetes suffer from long-term heart conditions and often face problems related to sensitivity in feed due to neuropathy. Now, some of the ways healthcare professionals can communicate with each other to provide the most effective care. Diabetic healthcare team mainly includes GP, that is general practitioner, diabetes specialist nurse, practice nurse, registered dietitian, diabetes specialist, registered uh, podi- podiatrist, pharmacist, psychologist. Firstly, I'm going to discuss about GP. GP's role in diabetes care may vary, but this is the doctor who is usually first point of contact for any health concern. Then diabetic specialist nurse, that is DSN. This is a nurse with specialized knowledge of diabetes. They give support and advice between appointments with things like blood pressure checks, um, adjusting your medication. Then practice nurse. Practice nurse from GP surgery may support your diabetes care depending on the specialized knowledge. Then diabetes specialist. This is doctor is who's a diabetes specialist. They are usually based at a hospital or maybe clinic. Although some areas have community diabetes specialist. Then registered dietitian. This is an expert in food and nutrition who can talk to you about right diet for someone with diabetes. Then is registered podiatrist. This is an expert in feet and legs. You will probably have yearly foot check at your GP, surgery, or diabetes clinic with the nurse, eye doctor. Then this is the doctor who's expert in eyes. Then pharmacist. This is the qualified pharmacist at your pharmacy or chemist, as well as giving you medications and supplies on prescription. They can take a look at medication and give you advice. Psychologist. Living with diabetes can be difficult, of course. If someone is struggling with emotional effects of diabetes, your doctor can refer you to a psychologist to talk it all through. The various ways of communication in health professionals. First of all, web meetings, virtual appointment apps, online patient databases, and online patient portals. Before discharging the patient, they should give proper education to the parents. If, as in this case, Sam is just 9 year old, so even doctors and other practitioners should discuss with the family as well as Sam so that they can get to know that how they have to make the changes to the lifestyle. And maintaining target blood sugar level is essential for controlling diabetes. Um, Patient must take insulin and consume roughly the same quantity of carbohydrate at each meal. Blood sugar level should be examined throughout the day. To monitor how well the treatment is working, see if the child's doctor at least every 3 to 6 months. Make a habit of child to get regular exercise. Apart from this, there should be meal planning for the kid so that people with diabetes may use low glycemic index food or other meal plans to avoid having high blood sugar levels after meals. Before implementing a new eating plan, consult a qualified dietitian. A good menu will also include increase the consumption of non-starchy veggies, include green beans, spinach, and broccoli. Reduce the amount of refined carbohydrates and added sugar, such as white bread, rice, and pasta, with less than 2 grams of fiber per serving. As far as possible, place an emphasis on the whole meals rather than having processed ones. Blood sugar levels increase when the diabetic patients eat food with the that contains carbs. Depending on the cuisines, carbs can boost your blood sugar quickly and slowly. And other than that, complementary therapies can be taken. You might be wondering if supplementary therapies, particularly natural health products, will be benefit child in addition to medical care. There is sufficient scientific support to conclude that any natural health remedy may treat or prevent type 1 diabetes. Here are the references. That's all about the presentation. Thank you.